I would like to talk to you how I feel stress plays a dramatic role in cancer patients and in other illnesses. It is something that I have seen play a role in treating cancer patients for almost 18 years. First, I want to talk to you about physical stress. Physical stress can be any type of symptom or complication that brings discomfort or suffering. Some of the most common stressors I've seen, physical stressors, can include lack of sleep. It's very common for cancer patients not to sleep, sometimes not at all. Or when they sleep, it's very disrupted because they're in pain, or they're coughing, or they're having trouble breathing, or they have swelling, they may have nausea, headaches, the list can go on. Another major stressor is pain. Pain is very common in cancer patients, and what I have witnessed is that most people, in general, people typically say, I don't take pills and I don't want to take pain meds because they don't want to get addicted and they're worried about side effects. Yet they suffer from 10 out of 10 pain. What I have found is that when patients do end up taking pain meds and their pain can be markedly reduced to almost perhaps even a low number, a low level, or to zero, it can help them relax. They can eat better, they can sleep better, they can actually interact with people better, they can tolerate treatments better, and it actually helps them feel better mentally, psychologically. When people are under stress, it affects their mind, and that's where stress also can play a major role. When people are anxious, scared, hopeless, or may have other stressors that are beyond their control, such as not having financial resources, or if they have stressors that may involve, let's say, family dynamics. That's a very common one. Cancer patients usually may not agree with what their family believes what is best for them as far as treatments and how they approach their treatment for cancers. These stressors can really take a toll on a person's health. I really do think ultimately one of the worst things for a cancer patient's health is stress. Because it has been proven stress can raise stress hormone levels, which can impair your immune function. And as I said earlier, it can affect your sleep. It can prevent you from relaxing, from eating, from interacting, from doing things that you have to do because you're impaired. There are times where I tell patients it's okay to take a pain medication because the benefits of getting relaxation is far, far more beneficial than the risks of taking a medication. And I really don't think patients should be afraid of getting addicted to, let's say, pain meds, for instance, because if they're in pain and it helps them reduce their pain, I don't think that patient is going to get addicted and want to take it to get high. That's not the purpose. I always tell patients, we want to minimize stress and get to the underlying causes of what's causing the pain or the trouble breathing or the swelling or the anxiety or whatnot. And we do what we have to do to bring that stress level under control. And as we work on improving the underlying issues, the stress will go away naturally, in which case you can a patient can eventually stop some of these medications. Psychologically, that's very difficult to work on, because there are some things that are just really hard to address. Let's say a person has an abusive relationship. They've been married and they have an abusive spouse, and that causes extreme amount of stress. When you have cancer, that does not help. So these type of things can be more complicated, but ultimately they should be addressed as well. I would say probably the best way to relieve stress mentally, emotionally, psychologically, and even spiritually for a cancer patient is as simple as getting better, feeling better. When a patient knows and finds out he is improving, and he gets news from the doctor who's excited that he is responding to treatment, that right there can really almost reduce stress instantly. And that stress can affect your body as well. So the body and mind are connected. Physical stress can affect mental stress, and mental stress can affect even your body and cause some psychosomatic symptoms. So I feel that in addressing the care of a cancer patient, one thing that has to be focused on and made a priority is to minimize stress, uncontrolled, and when severe enough, it can actually backfire and harm the patient itself. If you'd like to learn more about how we treat patients in alternative ways at our clinic, please feel free to subscribe to our YouTube channel.